Okay, so just to start off, could you sort of explain the current situation in Ontario's shelter system as it relates to everything that's going on with COVID?
Yeah, I think just like many other issues impacted by COVID, is everything's just a bit worse, right? So even going into COVID, we had very little vacancy rates in any shelters across Ontario, and particularly where I work in London, Ontario. COVID has only amplified that. So due to the necessity to distance people, to spread out dorm rooms, to make sure that isolation is available when it's necessary, it's reduced the amount of space that we do have in emergency shelters, and that's certainly impacting people who have to live outside now. Due to the realities of living on the street, many of our patients are also substance users and injection drug users. And many of them, as we know, of all people deprived of housing, their chronic diseases are kind of amplified a decade or two beyond what we would see. So a lot of people living with COPD, with diabetes, with hypertension, cancer, HIV, everything that you and I would have, but stepped up a few notches because of lack of access to care over their lifetime, and then the hardship in which they live. The reality of the situation is there has never been enough emergency shelter beds for the entire population of people living in homelessness. So that's only been amplified because of COVID. And I think as we move through the COVID response, we've actually seen a really nice uptake provincially and municipally in agencies looking to do things differently. So we've seen this across the province, but housing first agencies, cities are willing to put people in motel rooms, which is a novel response. But again, that's limited by funding, that's limited by the ability to staff. And that was true before COVID, and it's true during COVID. Initially, we did our best to get through that first 6 to 8 weeks, and that was hard. But then we started to realize this was longer term, right? So we've started to turn to, again, novel, new ways of supporting people. It's still really hard. There's still not enough space. There's still not enough basic services, but looking kind of, again, to the future, to how we keep people inside. Again, I want to commend all of these layers of government. They really did come forward with new funding, novel ways of thinking, but it only brings a spotlight to how there was never enough service in the beginning, and there is still not enough service now. So even with all of those influx of funding, in London, we still have about 200 people sleeping rough on the street, right? So even with all that extra money and attention, we have so many community members who are still outside. COVID really just brought this hot spotlight onto pre-existing issues, pre-existing problems, pre-existing gaps in the system, without a lot of forward momentum, right? So when we spoke in 2019, I mean, back we were probably around 12 or 13,000 people who had died due to the illicit street supply at that point. We're pushing 19,000 now. So that tells me we're really not doing enough differently. We know from data released by the Ontario coroner that week by week, overdose death rates have increased by 50% compared to 2019 before COVID. I think the unfortunate reality is that we've done everything on an acute short-term scale that we have the power to do at this point. Individual healthcare providers have done as much direct patient care as we're capable of. I think our local governments and even the province have made as much change and put as much cash in the short term as they're capable of doing. The solution to both of these in long-term care, the shelter system, the fentanyl crisis, is really 10 years ago, we should have been putting in long-term funding, long-term planning to avoid this in the first place. But now that we're here, people need to not just move back onto normality after COVID has pulled away from the landscape. They need to be looking at 1 to 5, 10-year solutions so that this never happens again, so that people are actually provided appropriate health care in the appropriate setting.